Pediatric is one of the subject which we are really scared of, especially when tackling acutes, because whenever okay, homeopathy seems to be very good with children. Children love homeopathy, but whenever we face acutes in children, we get scared. Whenever there's an acute emergency, we take a back seat, and at that moment we say, okay, you take any antibiotics or you go for antipyretics. But does homeopathy offer a great form of treatment in acutes, and how to follow that thing? Today, this is what I'll be going to share about. So, just give me a minute. Fine. So this will be my presentation today. I'll just start with the sharing of my screen. Okay. So homeopathy and pediatrics is my today's topic. So let us go ahead. These will be the points which I'll try to cover in my today's talk. My points will be like to learn the essence of pediatric case taking. Because I remember when we were a student, we were in college, the only thing whenever we used to get a pediatric child, we used to think how to take a case. What will a child say? We all face these problems, like a child doesn't know what his mind is. What does parents know what the mind is? So this part becomes quite difficult, and we'll end up giving Kali Sal for cough cases, or we'll end up giving Antemtart to cough cases, or urinary tract infection, we'll end up giving sarsaparilla or some other remedies. Without understanding a child, we take these steps. But today I just try to give some directions how we have to approach in pediatrics in a most classical way. Also in this talk, I would like to cover how to understand mind of a child. And the best way to understand a mind of a child is by mastering the art of observation. Dr. Samuel Hahnemann has spoken about observation in his aphorism footnote 85, and this is what we have to apply in pediatrics. And once we master this art of observation, pediatrics will be the most easiest thing to solve. And trust me, even though I get tough of the tough pediatric cases, I'm very happy because I know they're the most uncompensated mind, and I just have to work out with my observation, and it really helps a lot. I'll try to explain some differential pediatric rubrics, materia medica, and I'll try to even make you understand how to apply the child's psychodynamics into materia medica and how to apply it to our cases. I'll try to show some cases, and we'll get some answers like, does art of observation really help in solving pediatric cases, and how to communicate with our little patients, in my practice, I usually try to communicate with the child first rather than with the parent. Like whenever a child comes into the clinic, I just try to talk. I just try to, intrude into the child's space and see what reactions he's throwing. This is what I've learned from my teacher, Guru, Dr. B.S. Bhosle sir. And after applying this technique, I have understood and seen different reactions of every child. Like for example, if a child enters to your clinic and you just talk to the child, how are you? Are you okay? What happened? What is your name? And he will look down. Again, you ask a question, how are you? You're okay. What is your name? And he will give the answer and he will look down. So I remember one case where there was a child of 8 years age and he had thyroid. So they came for homeopathy. It was hypothyroid child and they came for homeopathy. So I was taking the entire case, asking his parents about the symptoms, and whenever I was communicating with the child, what I observed the pattern, like, I'm looking at the child, asking him the question, and he just looks down and he gives the answer. Like, for example, how's your thirst? He will say, my thirst is good. And when I talk to the parents, he will look up. So this repeated pattern, I put this rubric, took as a rubric, and I put in the repertory. And the rubric is evading the look of the person when you talk to the person. So the main remedies which come for this rubrics, evading the look, remedies like you have Natrium miraticum, you have plumbum, you have cuprum, you have agaricus, you have stramonium. So this was one of the most repeated observational symptom which I observed in the child. Again, for observation, I would like to add one more thing. Just do not take that rubric which the child just throw once. You have to just see, is there any pattern? Is this pattern repeated? If yes, then that is a strong rubric, or that is a strong symptom which you should take into consideration. And of course, I gave the child remedy stramonium because there were some other symptoms, like he was a very frightened child, and he had fear of dark, and he had history of abuse in his childhood. Like just before this incidents, he was abused by some of his friends. He was little fat, so all his friends used to tease him. They used to tease him to such an extent that he used to get violent and he used to hit the children. Again, abuse, history of violence. But again, the child was very timid. He always used to be with his parents, and this rubric, evading the look, that confirmed the remedy, and I gave him stramonium, and I was very happy with the results of the case. I saw drastic improvement in his thyroid level, and that child was labeled a normal child. So this is what art of observation we have to apply in our cases. So one simple question which always arises, and we should always think about this: what is the need to treat pediatric cases with classical homeopathy? So, many times in practice, we see people just give a remedy. Like, as I said, there's a lot of cough, you give Ipecac. There's a lot of cough, you give Antimtar. There's cold and coryza, you give Alum Cepa. But have you ever thought, what is the need to treat pediatrics with classical homeopathy? Because, when you are a child, or when you get a child as a case, they are the foundational age. That is the foundational age of that person. Like whatever you put as an input at that age, in all the levels, like be it social level, be it emotional level, be it medicinal level, be it mental level, that will form the foundation and growth of his future life. So when we get pediatric cases, we have to be super careful what remedy we are prescribing. Because I remember a statement by Professor Vitinka sir. He said, our medicines are, though very minute, are more potent than nuclear weapons, nuclear bombs, because they have the capacity, if given in a wrong way, they can just disturb the whole human economy. Or there is a, there's harmony inside every human being. So these medicines can disturb that harmony, or when you give the correct remedy, they can set this harmony in a proper way. So I believe personally, whenever we get pediatric cases, we have to be very particular. We have to be very vigilant what approach we are giving to the child. There are so many doctors who just blindly give, uh, homeopathic patents. I remember there was a person who came to my clinic, and he just came to take some medicines. Someone had prescribed a remedy, and the child was just 3 years old, and someone had prescribed Sorinum 1 m daily for a month, and some mother tincture, and it just gave me goosebumps. I was like, how can someone prescribe Sorinum 1 m for 1 month for a 3 years old child, and he has never seen the child? He can just beat his immunity, he can just destroy his foundation. So we have to be extra careful and vigilant and with treating a child. So the next question, after when we decide, okay, I will treat children with classical homeopathy, the next question arises, how? Homeopathy is too slow. This is one thing we are doubtful, and the patients. Second, we are actually very scared to tackle acutes. TK patient is having LRTI, URTI. We give homeopathy. Whenever they get acute, okay, you give antibiotics. Okay, you take this anti-allergics for this time. We'll see when the patient is settled. I think that is not the correct way to go with, right? Then we are doubtful when the child comes with acute fever, leukocytosis. Okay, for this time I'll give antibiotics. Next doubt: should I fear fever? Whenever a pediatric child comes to our case, so I always tell the parents, I will start the treatment, and for initially 3 months, there will be a lot of ups and downs in the cases, specifically when the child has a long history of suppression by antibiotics, antipyretics, or anti-allergics. So I just tell the patient there will be lots of ups and downs in initial 3 months. You have to be with me. You do not have to get scared of fever, because fever is something which is very good and I expect after my correct remedy. So should we fear fever, and how should be approached. I will be talking about those things and how good it is to prescribe specifics in children. So these are some of the points which I will be trying to clear. And
Good night.
Good night.